In this video, we'll take a look at some of the causes and treatments for mood disorders, starting with the depressive disorders and some of the biological factors that are thought to play a role. When it comes to biological factors that are believed to play a role in depressive disorders, things like genetic factors, biochemical factors, brain anatomy and brain circuits, as well as immune system functioning, are thought to come into play. So we're going to take a look at those real quickly, and then we'll talk about a few different categories of biological treatments, things like electroconvulsive therapy, antidepressant drugs, and deep brain stimulation. Evidence for the role of genetic factors in depressive disorders comes from what are called family pedigree studies and work in the field of molecular biology. Family pedigree studies involve looking at the degree of relationship in families and concordance rates for particular disorders, in this case for depressive disorders. When we calculate concordance rates, we look at how often it's the case that if one family member has the disorder, another family member does as well. And we compare those concordance rates according to degree of relationship, looking at how closely related individuals are or how genetically similar they are. For example, many of those studies involve comparing concordance rates between identical and fraternal twins. In one study of almost 200 sets of twins, there was a 46% concordance rate for identical twins for depressive disorders and a 20% concordance rate for fraternal twins. If genes play a role, that's exactly what you would expect in comparing rates for identical and fraternal twins. Because identical twins have identical genetic makeup or identical genetic information, and fraternal twins are no more genetically similar than regular siblings are, you would expect to see higher concordance rates among identical twins. But it's not purely genetic, because if that were the case, then we would be more likely to see a 100% concordance rate for identical twins. Studies in molecular biology have been working to identify particular genes that might be associated with depression, and at this point there is some evidence that a number of genes on particular chromosomes may be linked with depression. So that's something that we will probably see more about in the next several years. In terms of biochemical factors, there's evidence to suggest that brain chemistry is involved in depressive disorders, and a lot of the research in this area has focused primarily on two neurotransmitters, norepinephrine and serotonin. This link was stumbled upon back in the 1950s when it was discovered that high blood pressure patients taking certain medications were more likely to be depressed. Upon further examination, it was discovered that these medications lowered levels of either norepinephrine or serotonin, depending on the medication. Now, while a lot of research has focused on the role of these two neurotransmitters in the experience of depression, there is also evidence that the endocrine system may also be involved in experiences associated with depression. In this area, it's believed that levels of a couple of hormones may play a role, cortisol and melatonin. People with depression have been found to have abnormally high levels of cortisol, a stress hormone, in the bloodstream. This is a hormone that is secreted by the pituitary gland during times of stress. Other evidence that the endocrine system plays a role in the experience of depression comes from studies finding that a significant number of individuals with depression have abnormal melatonin secretions. Melatonin is a hormone that's influenced by light exposure. At night, when light levels are lower, melatonin begins to be secreted, and this is part of what makes us feel sleepy as we get later into the day. Studies have suggested a possible connection between melatonin and the experience of a seasonal pattern of depression, where people are more likely to become depressed during the winter months. These researchers suggest that individuals with seasonal depression may secrete more melatonin during the winter, and that this may be in some way related to the higher levels of depression that these folks experience during that time of the year. There has also been some research into the role of brain anatomy and brain circuits in terms of potential causes for depressive disorders. And a number of biological researchers have started to suspect that emotional reactions of various kinds are tied to brain circuits. Now, this research is far from complete, but there is a circuit that seems to be responsible for unipolar depression, or at least that's what's emerged with some of the evidence. Likely brain areas in the circuit include the prefrontal cortex, the hippocampus, the amygdala, and an area called Brodmann's Area 25. And so research is continuing in that and continuing to look at some of those possibilities. Now, with regards to immune system functioning, um, the body's network of activities and cells that fight off bacteria and other foreign invaders, of course, make up the immune system. And it's been suggested that when stressed, the immune system may become dysregulated, and some people believe that that may help produce depression in certain individuals. So, if there are biological causes, or at least potential biological causes of depressive disorders, it would follow that there are different types of biological treatments for depressive disorders. And there are a number of types of biological treatments, including electroconvulsive therapy, antidepressant drugs, and brain stimulation. So, to begin with, um, we'll take a look at electroconvulsive therapy as a biological approach to depressive disorders. This is a treatment where electrodes are attached to a patient's head that send an electrical current through the brain that causes a convulsion. And the discovery of ECT as an effective treatment for depression was actually accidental. It was initially based on a false assumption, and it was initially used in the treatment of schizophrenia because it was believed that schizophrenia and epilepsy could not coexist. And so, to begin with, it was used as a way to treat schizophrenia. However, eventually it started being used for a number of different things, and it was being tested out in different areas. And it was discovered that schizophrenia and epilepsy can coexist, but it was also discovered that electroconvulsive therapy was somewhat helpful for some people with depression, particularly pretty severe depression that hadn't responded to other forms of treatment. So it is a pretty controversial form of treatment. It's been modified in recent years to reduce some of the negative effects. For example, patients are now given muscle relaxants and anesthetics before and during the procedure, and patients generally report some memory loss afterwards, but for the most part, that is temporary, and their memories come back later. But the electrical stimulation is very targeted, and of course, it does cause that convulsion. It causes those seizures. And for some severely depressed individuals who don't respond to other forms of treatment, it does appear to be pretty effective. The usual course of treatment with ECT is about 6 to 12 sessions that are spaced over about 2 to 4 weeks. So, again, it does seem to be effective in treating some cases of depression, but it's been hard to determine exactly why ECT works so well for those folks. But studies find improvement in about 60 to 80% of patients. Again, particularly in cases of severe depression with delusions. So that's also considered a biological treatment for depressive disorders. In the next video, we'll take a look at a couple of other types of biological treatments for depressive disorders, different types of antidepressant drugs, and some of the work that's being done with brain stimulation.